What is OHA's role in dealing with cyanotoxins and other types of water contaminants?
Sure. Well, so there are two broad categories of contaminants in water. There are those that are regulated, cryptosporidium as an example, fecal coliform, those kinds of things. And then there are unregulated pollutants, which cyanotoxins are a part of. And our role is a little bit different in each of those. In the regulated category, EPA establishes regulatory standards and a set of procedures of what you need to do when those pollutants are found to be present. In the case of non-regulated toxins, there's guidance, and our role is really to provide advice to a water provider about how to apply that guidance. But there's not any kind of it's all optional to the water provider, and it's their call how they want to manage that. Partly that's why we're moving forward with establishing a temporary rule to make cyanotoxins a regulated pollutant in Oregon. I think this is an emerging health threat that we've not had to deal with significantly before. The Salem instance was the first time cyanotoxins have ever shown up on the finished water side of a water treatment facility. And so we think we need to take some action that's maybe a little bit different than what the federal government has established for that right now. The interesting thing to me, I got interested in this question of who told who what to do when, and I was really puzzled by the conflicting positions on that. And I did a little digging, and I think I figured out what was happening. Our scientific experts were talking to the experts at the city of Salem, and having a fairly black and white conversation about when is it appropriate following the EPA guidance to issue a do not drink advisory, which gets into the whole notion of a 10-day window that you have to try to adjust the operation of the water system to get rid of the toxins because it takes that long for there to be a potential health effect and those kinds of things. And everything that everyone did in terms of that issuing a do not drink order, I think was exactly by the book and was done correctly. The conversation that didn't happen is actually a little bit different, which is regardless of whether a do not drink order gets issued, at what point do you tell the public about the results that we've found? And those are actually two different things, and we didn't handle them as two different things. We were having really scientific experts talking about expert stuff and not a public communications element. And I think that's the thing that we learned really quickly, actually. It was just a few days later in the Wilsonville case where they had a positive test result, and we and others urged them to go public with that, even though it wasn't anywhere near appropriate to issue a do not drink order. And of course, they ended up not reconfirming that test, and so that turned out to not be an issue up there.